One of the architects is Bill Cassidy. He's a doctor, he's a Republican senator from Louisiana, and he's the chairman of the Senate's Health, Education, Labor, and Pensions Committee. He joins us now from the Pelican State. Senator, I want to hear about the details of your plan, but first let's talk about timing. Congress needs to complete a spending deal in less than 2 months to avoid another shutdown, and the first Obamacare enrollment deadline hits December 15th. Are you open to a short-term extension while you all work on a bigger plan?
First, let's just say that John Thune has promised Democrats a vote on a proposal in mid-December. And that could just be a Democratic messaging bill that has no chance of passing. What I would like is that we don't have a Democratic bill or a Republican bill, but an American bill that will pass. And let's talk about the subsidies. If you take the same subsidies that people want to continue and you redirect them to the lower cost bronze plan, it is lower cost. And you can take the savings and put them into the health savings account. It still uses the same architecture that we have to use for 2026, but it actually gives the consumer, the patient, the power, money in her account to, one, pay for her deductible up front, and two, to pay for the care that she knows she needs, as opposed to the care that the insurance company gives her permission to have. So instead of giving $26 billion to insurance companies.
Let me just ask. I want to get into the details of the plan very much, but I want you to tell me, so you think you could do something in a short enough time frame that would mirror your larger plan, but you could get it done before the shutdown clock runs out?
Because we're still using the same architecture. So the answer is yes, Chris. That we're still using a bronze plan, which is on the current, your choice. You already have that. We have a health savings account system, which has already been permitted by law when we passed the tax cut for working families bill last year. So we already have the legal infrastructure. All we have to do is redirect the subsidies away from the insurance companies and give them to the people, power to the patient.
So then the bump out, so when we look ahead into the whole thing, this is basically the government would put the subsidies to individuals in health savings accounts, and then they can spend it how they choose to spend it. Is that right?
So there's two types of subsidies under Obamacare. There's the baseline subsidies started with Obamacare. We don't touch that. What we're arguing about is the enhanced premium tax credits. Obamacare was so expensive, the Biden administration had to subsidize the subsidies. That's what we're talking about. And let's redirect that from the insurance companies, redirect it to the patient, into a health savings account. We make sure that the premiums on the bronze plan are not higher than, say, 8.5% of your income level, just like last year. But there's so much savings, you can give it to the patient and let her choose the care she wants.
Okay. Now, Obamacare proponents are going to say that this is just a backdoor way to kill the program. Once the beneficiaries can choose what they want to do with the money, many are going to not participate, which is already a problem, which is part of why we need subsidies, or the subsidies are there because it keeps getting more expensive. And if you have exchanges with just the sickest and most expensive customers, that the whole thing is going to fall apart. What do you say to that criticism?
That criticism shows they're not listening to what I'm saying. The baseline subsidies stay the same. Folks still use that baseline subsidy to purchase the care that they want on the exchange. And they would still get their bronze plan on the exchange. It's just that we're doing a bronze plan instead of a silver plan. And instead of somebody having a $5,000 deductible, I'm a doctor. Patients, I can tell you, patients cannot afford a $5,000 deductible. We give them a health savings account, and that pays for the first $1,000 or $2,000 of that deductible. And that decreases their total cost of being insured. Premiums plus deductible will be less under our plan, and they have that first dollar they need to pay for their deductible and their copay.
Okay, this is unfair to you because you've been working on this since you were in the House when Obamacare passed. You have been talking about Republicans need to get on the good foot when they talk about a replacement and all of this stuff. But your party has not been along for the ride on this. Why haven't Republicans dug in and gotten serious about an Obamacare replacement? And why should we believe that this is something that Republicans have the political will to do now rather than just messaging on a painful subject?
I'm gonna quote Bishop Tenney, an old Pentecostal pastor I knew. And he said, "A good idea whose time has come cannot be defeated." We had good ideas before, but the time had not yet come. now the time has come. The policies are so expensive, with $5,000 deductibles, with 20% of the income we give to insurance companies going for profit and overhead. People realize, wait a second, give the patient the power. Let's take the money going for profit and overhead, give it to the patient, 100% going for the care she chooses. It's a great idea, but now the time has come, and I think now's the time for that great idea to be put in place.
Okay, you told reporters last week that you had talked with Health Secretary Robert F. Kennedy Jr. about some controversial changes to the CDC's stance on vaccines and autism. You and the Secretary have clashed on these issues multiple times. What did you tell him, and what did he tell you? Are you satisfied?
So clearly, let me just speak as a doctor. Vaccines are safe. It's been shown over and over again they don't cause autism. But if your child's not vaccinated, she's at risk of dying. He's at risk of being in the neonatal intensive care or in the intensive care unit intubated because they did not get vaccinated. Please be vaccinated. Discuss it with your physician. I shared that with the Secretary, but he's got his own position. My position, by the way, in the same position as President Trump, vaccines are safe. They don't cause autism, but if you're not vaccinated, you and your child are more likely to die from one of those illnesses like measles and mumps that the vaccines prevent.
Okay, before I let you go, there's a back and forth today between some of your Senate colleagues and the administration on a Ukraine peace proposal. Senator Mike Rounds and others say that Secretary of State Rubio told them the 28-point proposal is just a Russian wish list, not the White House plan. Secretary says that's not true and that the plan, which includes some pretty crippling concessions from Ukraine, is U.S. policy. What do you understand to be happening here? Do you have any insight for us?
I wasn't part of that conversation, but if Mike Rounds says that, I believe it. He's a stand-up guy. Let me say that. And President Trump has said that this is not the final plan, but it's a process of negotiation. And it certainly does look like a Russian wish list. And so I think it's better for the United States not to make such incredible concessions to the Russians, because I think ultimately it puts us at a disadvantage. But let me pause for a second. I thank President Trump working so aggressively for peace between Russia and Ukraine. That's something that Joe Biden never did. But I don't think this is the plan, because I don't think it ultimately leads to peace.
Okay. America, if you ever put Rabideau's sausage from Iowa, Louisiana in your gumbo, you would know him already. But if you don't, there he is, Senator Bill Cassidy. We thank you.